Pardon?
When you're scared, you get.
You're scared.
When
you're cold. Anybody have an erection going on right now? That can demonstrate here? Nobody? No? Nobody? What else? All right. Okay. So that's it for that. Now, of course, guys, keep in mind you have this right here and this right here. So this is what constitutes your skin pretty much: epidermis and the underlying dermis. Now, what's underneath these two major layers? What's underneath that? You have a region known as the
subcutaneous
hypodermis. Okay, so you have epidermis, dermis, and then you have an area known as the, well, here your book calls it a subcutaneous layer. Other people, like myself, like to call it the hypodermis. Why? Because it is underneath the what? The dermis, hypodermis. Of course, what do you find in the hypodermis, guys?
adipose.
People, right here. The adipose. Yeah, the adipose. Or what's known as the subcutaneous adipose tissue. Okay. Okay, so that's it for that, folks. I'll just leave it at that, and of course you'll be looking at a slide section here. Okay, so you'll be looking at that, this upstairs in your little slide section, skin section slides. Okay, you should find some nice collection of items, smooth muscle, some hair follicles. You may find some blood vessels. You might get lucky. You should find, depending on the cut of the section, you might find some skeletal muscle at the very bottom underneath the adipose tissue. Okay. All right. Any questions regarding today's? Oh, I'm sorry. The fetal discussion so far, and then I'm gonna do a nice demonstration here. Any questions, guys? Okay. For the show and tell. Okay, that's correct, folks. Okay. Yes. Here's the larynx. All this is part of your respiratory tract. You work your way down. You see, all this is, of course, guys. You recall that this is cartilage, right? This is what? Hyaline cartilage. Okay. Work your way down. More cartilage here. Cricoid here. Here, and then look, the tracheal rings that I talked about earlier, guys. Tracheal rings. Tracheal rings. Okay. Actually, folks, you guys remember the thymus gland that I demonstrated, the fetal lungs, and yeah, I'm gonna actually now as I brought this up, I'm gonna throw that onto the table and put it side by side with this, so you can see the difference in thickness of these tracheal rings, how they go from a, I think that's like a newborn, right? Did anybody see that when you were looking at the thymus gland? Anybody recall? Okay. Actually, what I'll do is I'll throw it in here onto the tray. You guys will, that'll be like a little activity today. Try to find the tracheal rings in that fetal trachea, okay, in the wall of the trachea. So here's the nice, well-developed, you can see tracheal rings. What function do you think those rings serve? What purpose do they serve in the wall of the trachea?
Structure.
Yeah, this is structure, you're right, buddy. Pardon?
To keep it from collapsing.
Say it louder, please.
To keep it from collapsing.
Absolutely, folks. Can you afford to have that trachea take a collapse like the Miami Heat? I'm gonna be bringing that up all year. I don't care. The whole year. Collapse like in the fourth period. Right? I don't remember. Whatever. Fourth period. Anyway, so can you afford? No, you can't afford to have that. Folks. That thing has to be nice and firm and open. Okay. All right. So here's your trachea. Here's your tracheal rings. And as I mentioned, well, you can't see it here because I actually cut it off at this point. But as I mentioned, once the trachea works its way into the lung tissue, you lose the rings and you get what? Plates, hyaline plates, okay? All right, whoops, I forgot to show you this, guys. Let me go back to this here. You gotta remember this individual from your practical exam. Whoops, okay. All right, anyway. Okay, so here you go, folks. Oops. I'll stop you here, putting me back out here. Oh, no, I didn't want that one. Well, anyway, folks, no, I didn't want that. No, I didn't want that. I didn't want that one. That one has, let me see here. Okay, I remember, folks, here they had. Okay. What do you not see in this picture? Okay, why is it not? Okay, I need light. Well, what is so dark? Can you look yours? Okay, what do you not see in this picture, guys? Well, this is a nasal cavity. Okay. Would you see here is the septum. Okay, the cartilaginous septum. Okay, so or septal cartilage. Okay, this is if you're not sure where this is later today, when you're at home, placing your finger inside your nasal cavity. Okay, you feel a little wall. Happens to a little wall. Okay, that's what that wall is right there. You have a wall that separates the two sides of your of your nose. Okay, there's your nostril right there. Can you see that? Okay, anyway, so you have that. That's not good. So now here, that's what I'm trying to focus on. Here we go. Here's that focus right here. Here we go, guys. Remember I talked about the nasal? Here we go. Here's the terminates right here. Here's one here. Here's one here. And there's actually one. This one's a little higher. Actually, you can see a little sliver of it. It's right there. Okay. So this is air goes into the nasal cavity, folks, and due to the epithelium, the lining here. What do you have here, guys? Pseudostratified epithelium, correct? But when you go all the way to the top, the superior nasal conchae, what kind of epithelium do you have at that point? I showed it to you earlier. What kind of epithelium do you have way at the very top of the area of the superior nasal conchae? Pardon? No. Well, it is simple squamous, but it begins with an olfactory. Okay, remember, because all this right here, for folks, remember, there's all this olfactory epithelium, because right at the area here, you have your olfactory bulb sitting top here, ready to pick up the odoriferous emanations of mom's what?
Cooking.
Baked macaroni and cheese, right? Right? Anybody like baked mac and cheese? Well, how about vaca frita? Yeah, okay, well, good. Okay, anyway, enough of that. Okay, so epithelium, okay, the lining has secretions, acts as a filter, cleans up, and filters out, warms the air, moistens it too, okay, and also moistens the incoming air inside the nasal cavity. Okay, so enough of that. You saw the tracheal rings. I'll bring the fetal lungs upstairs in case you guys can see that, and then we put these heads here. Okay, get this out of the way. Now let me move on to who that is. That lung, the lung. You don't believe me? There you have it. Okay. Now, and guys, and it's also what? Also nice and what? Fresh. So I said juicy, not fresh. Yeah, juicy, but it's nice and fresh, guys. Nice and fresh lung, okay? Now, for starters, you'll notice, okay, notice how this is all this tissue right here, folks. This is pleura. This is what lines the actual organ, actually the cavity where the organ lies in. It is also, if you look here, folks, you guys look here, guys, you know that shine, that glittering shine that the organ has right here, okay? There's also a lining on the actual organ itself. So you have all that shine you see here, okay? All that's, it's pleura, visceral pleura, lining here. You also have lining here. But the point here, folks, I think on your checklist, guess what has worked its way into this pleura? Look at that, guys. Look what's worked its way into the pleura of this lung tissue. What's that yellow stuff?
Adipose.
Adipose, folks. So this is actually called, it's on your checklist, I think, it's on your checklist, it's called extrapleural adipose. Okay, this is extrapleural adipose, or adipose tissue that has embedded or found its way into the pleural cavity. Okay, extrapleural adipose tissue. Okay. All right. Now, finally, once folks, you'll be working with this later. You'll be working with the histology here. What's going to happen is you're going to, guys, if you zoom in and you zoom in more, you're going to kind of like run your fingers, folks, through all this tissue here. See all those little white little, I see white little structures like that, folks. See little white little bumps here, and as you, this is kind of rough when you run your finger on it, folks. What you're feeling when you're palpating is pretty much the terminal bronchiole. All the little terminal bronchiole, look how small they are. All these little, you see these little very like almost microscopic, very tiny little terminal bronchioles. And you might find some, if they're very small, like that one right there. Here's a little bit bigger one. When you get down to like this level, these little tiny ones, those almost like dots. Yeah, you can come across terminal bronchioles. See, look, you can see one there. Here's one right here, folks. These very tiny, almost microscopic bronchioles. Those are the terminal bronchioles, which eventually empty air into the respiratory bronchioles, which then eventually go into the what? Alveolar duct, and then into the alveoli. Okay. So when you later today, when you're upstairs, just run your finger. You can actually feel for some of these little bumps, and what these bumps are the terminal bronchioles of the lung tissue. Okay. Right here. Look at all these little white one there, one there. Okay. All right. And that's it. Finally, folks, no one has arrived. Adipose tissue. Okay. So make sure that when you're holding this piece of skin, okay, then you're able to look and appreciate what lurks above, two parts, and then what lurks below the epidermis. Okay. Okay. Any questions, folks, regarding today's pre-lab discussion? Okay.